Biosas to Ondo State, where the state government has launched a new fleet of ambulances for deployment across the state. Governor Lucky Ayedatiwa says the initiative reflects his administration's commitment to transforming healthcare and enhance efficiency. Senior reporter Ayodeji Muradeyo has details.
It was the official unveiling of a fleet of ambulances procured by the Ondo State Government to boost emergency medical response across the state. Represented by its deputy Olaide Adelami, Governor Ayedatiwa said the new ambulance system will ensure timely intervention during emergencies. He explained that unlike previous arrangements which focused mainly on accident-related rescues, the new initiative will cater for all medical emergencies. The governor reaffirmed his administration resolve to close existing gaps in emergency care and protect residents, regardless of their socio-economic status, from preventable deaths.
Under this program, both transportation to health facilities and treatment of any medical emergency for the first 48 hours will be at no cost to the patient, as the cost will be borne by the government through the National Emergency Medical Services.
Also speaking, the Director General of the National Emergency Medical Sciences and Ambulance System, Ajia Fatima Shiroma, said the initiative will help reduce the burden on hospitals and improve overall health care delivery. The Ondo State Commander of the Federal Road Safety Corps, Samuel Ibitoye, described the program as a critical tool for improving road safety and emergency management.
Imperative that we have a well-organized and efficiency system that can respond quickly to all types of medical emergency, provide timely medical assistance to those in need. Today, with the launch of this emergency medical service and ambulance system, we take a significant step toward achieving that goal.
I want to say the governor has now stood as the architect of modern Ondo State. We can see, thank you so much, we can see various junctions emerging with traffic lights that can compare to any nation in the world.
The ambulances are expected to be deployed to the 3 senatorial districts of the state to save lives and reduce fatalities from accidents. Ayodeji Muradeyo, TVC News, Akure.
Ayodeji Muradeyo joins me now from Ondo State. Ayodeji, how extensive is the new ambulance deployment plan? Do we know how many units will be stationed across the state, and what criteria determine their locations?
Let me tell you that this program has been in a system before, but it has been reactivated by this government, and it is in partnership with the federal government to ensure that people are safe from dying, most especially people who have emergencies. Let me tell you that these ambulances will be stationed at different locations across the 3 senatorial districts to ensure that people who are in critical conditions are attended to by moving them to a nearby hospital that is very close to them. And this transportation will be done free of charge by the state government. And an emergency call unit has been established to ensure that the people who have emergencies can put call through to people who have been trained to receive their calls and to ensure that they are attended to without delay. So the government is ensuring that it also goes through the social media to ensure that the people, they are aware of this. There are dedicated lines that have been reactivated, so that the people can call if you are in a critical condition. The ambulance will move to your location, whether you are in the south, whether you are in the central, or you are in the north senatorial district. So this is what the government intends to do with this new system, to ensure that people are attended to, and if they have serious condition, and people who have accidents, most accidents, people don't really die until they get to the hospital. So that these emergency ambulances will be used to attend to them, to stabilize them before they are moved to various hospitals. For now, this is the plan of the government to ensure that lives are saved.
I like that you spoke about time. Are there established response time targets? And is the state setting up a centralized dispatch or call system to coordinate these ambulances?
Yes, there is a central unit that will coordinate these ambulances. When people call, they have people who will respond to them, respond on time. Once they respond to their calls, they will direct them to the ambulances immediately, so that these ambulances can move to these different locations to ensure that their issues are resolved. And these ambulances will work for the ambulances will be working regularly at different locations to ensure that they attend to the people. When calls are put through, they attend to emergencies.
Thank you, Ayodeji.